Good afternoon, everyone. I'd like to begin by thanking Dr. Wallerstein, Dr. Eldridge, and Dr. Gillum for inviting me back to share a video presentation with you all today on health and generative AI misinformation. My name is Jageson Deviant. I'm a dual degree developmental psychology PhD and epidemiology MPH student. Much of my research has focused on attitudes, behaviors, beliefs, and perceptions of the COVID-19 pandemic. Information literacy and generative AI usage in academic settings are also core topics of interest for me. Today, we'll explore examples of how misinformation and generative AI impact public health. To begin with, the terms misinformation and disinformation are often used interchangeably. The difference between misinformation and disinformation may be subtle. Both are false, inaccurate, or misleading according to the best available evidence at the time. The difference is whether information is shared with good intentions or deceitful intentions. An example of misinformation might be someone sharing a false claim about vaccine safety without verifying it first. In contrast, disinformation would be a deliberate campaign to spread false vaccine safety information to intentionally discourage vaccination. In this context, it's also important to understand the concept of an infodemic. An infodemic is defined as an overabundance of information, both accurate and false, that spreads rapidly, especially during a crisis like a pandemic. This makes it difficult for people to find reliable sources or discern fact from fiction, contributing to confusion and mistrust in health guidance. The core reading for this module was Misinformation in and about Science. I think that it's useful for all of us to appreciate that misinformation exists within science and that science has its imperfections. The reading will have introduced you to a variety of problems that exist within science and give you some new tools to help you critically appraise informational content you come across. Additionally, this could help you to identify and mitigate the potential for generating and spreading misinformation in your own research and work. Predatory publishing focuses on collecting open access publication fees. They do not invest in the gatekeeping, curation, and manuscript improvement roles of traditional journal publishers. They often use journal titles that closely resemble titles of well-respected journals or journal titles that sound legitimate. Their websites are usually professionally constructed and convincing. The market for predatory publishing is estimated to be worth between $75 to $150 million annually, and there may be more than 15,000 predatory journals in publication today that have published hundreds of thousands of articles. A prime example of a COVID-19 disinformation article published in a predatory journal is titled COVID-19 RNA-Based Vaccines and the Risk of Prion Disease, which was written by J. Bart Clausen. It makes extraordinary claims about COVID-19 vaccines causing prion diseases without providing any actual evidence to support this assertion. The author suggests, without credible evidence, that COVID-19 is a bioweapon and implies a conspiracy involving the Bill and Melinda Gates Foundation. Filter bubbles are created by algorithms that are designed to show people personalized content that they are likely to be interested in. This can lead to people being exposed to a narrow range of information that is filtered out based on their past behavior, such as their search history or the websites they visit. For example, people have been searching for information about the COVID-19 pandemic or climate change who already hold doubts might only see news articles that support their beliefs that the pandemic is a hoax or that climate change is not real. This could reinforce their doubts while simultaneously limiting their exposure to factual health information. Bots further complicate this problem. Bots are automated programs that could rapidly share and amplify specific messages within filter bubbles, making false or misleading information appear more credible and widespread through repeated exposure. Echo chambers are created when people self-select into groups or communities, thereby surrounding themselves with information and opinions that reinforce their beliefs. This can happen on social media, in online forums, or even in real-world settings. When people only interact with those who agree with them, they're less likely to be exposed to opposing viewpoints or information that challenges their beliefs. The algorithms used by social media platforms and search engines can amplify the reach of information that is popular or predicted based on past behaviors. Echo chambers have had a significant impact on vaccine hesitancy, where groups of people with similar perceptions and beliefs reinforce each other's skepticism, making it harder for reliable information and public health campaigns to reach them and have a positive effect. Scientific data may be presented in ways that misinform. The chart type, scales, and axis ranges, bin sizes of histograms, presence or absence of visual decoration, and other graphical conceits can influence a story in any direction a designer chooses. Without training, readers can easily be fooled. Even with the best of intentions, researchers can stumble when interpreting their data as they try to navigate around statistical traps, various biases, confounds, and other limitations. Data can also be reported in ways that may be misinterpreted or misrepresented, thereby presenting opportunities for doubt to be created and spread, and false narratives to be amplified. For public health professionals, misinterpreting data can lead to incorrect conclusions, which may ultimately affect policy decisions and interventions. When interpreting data visualizations, always look at the axis ranges, legends, footnotes, and other accompanying information, and consider whether the design choices might be influencing how the data is perceived. This will help you avoid being misled by subtle distortions. Health misinformation tends to spread rapidly due to several factors. Often, health-related content is sensationalized to provoke excitement and a strong emotional response, making people more likely to engage with and share the information. Social media platforms are designed to incentivize and reward engagement, interaction, and sharing, creating an environment where provocative or surprising health claims can gain traction quickly. Content distribution algorithms on these platforms determine what users see based on their perceived level of engagement, potentially amplifying the reach of misinformation. Additionally, confirmation bias plays a significant role in this process, as people tend to seek out, believe, and share information that confirms their existing beliefs or fears about health issues, further accelerating the spread of false or misleading claims. The COVID-19 pandemic has provided numerous examples of this phenomenon, particularly with the rapid spread of misinformation about unproven treatments such as ivermectin or hydroxychloroquine. Despite lacking scientific evidence of efficacy against COVID-19, claims about these drugs spread quickly across social media and other platforms, demonstrating how health misinformation can proliferate in times of uncertainty and fear. The combination of these factors, along with the fast-paced nature of online information sharing, contributes to the rapid dissemination of health misinformation across various digital platforms and communities. Common sources of health misinformation include alternative health and politically biased websites, news media reporters and opinionists, radio show and podcast hosts, politicians, religious leaders, and government officials. Even some clinicians may be sources of health misinformation, as we saw during the pandemic with groups like America's Frontline Doctors and the Frontline COVID-19 Critical Care Alliance, which were some of the most influential promoters and amplifiers of COVID-19 health misinformation. Even the scientific literature can be a source of misinformation. In fact, hyperpolarized content might be initiated, spread, and amplified through any of these sources, making it difficult for the public to discern fact from fiction. Here are a few examples of COVID-19 misinformation statements. Masks are ineffective for reducing the spread of COVID-19. More people have died from COVID-19 vaccines than have died from COVID-19. Healthy athletes are dropping dead on the field shortly after receiving COVID-19 vaccines. COVID-19 vaccines have been proven to cause infertility. Ivermectin and hydroxychloroquine are effective treatments for COVID-19. And more people die of the seasonal flu than die of COVID-19. Each of these examples has real-world consequences, like discouraging vaccination or leading people to take unproven treatments that may be harmful. Understanding these myths helps us develop better public health messaging. COVID-19 health misinformation poses a threat to public health for many reasons. Nationwide, Healthcare workers have been burning out. It's put a strain on hospital capacity and resources. The use of unproven and potentially dangerous interventions has been heavily promoted, while proven medications like oral COVID-19 antivirals and vaccines are sitting on shelves going unused, often expiring. Millions of people nationwide are skeptical of or distrust scientists, as well as our institutes of medicine and public health. It's also fueling a parallel pandemic of long COVID and contributing to an enormous number of excess deaths. COVID-19 health misinformation is also resulting in monumental divides between family, friends, and entire communities. The spread of misinformation doesn't just affect individuals. It weakens public trust in health systems and reduces the overall effectiveness of health interventions. Misinformation has fueled the spread of COVID-19, contributing to a parallel pandemic, often referred to as a mass disabling event. Long COVID can be defined as coronavirus symptoms that persist or return 3 months after a person becomes ill from infection with the SARS-CoV-2 virus. Today, long COVID remains a significant public health concern, affecting approximately 17 million U.S. adults, or about 7% of the adult population. According to an April 2024 report from the Kaiser Family Foundation, about 3 in 10 adults who have had COVID-19 report experiencing long COVID at some point. Of that group, 25% reported long COVID limiting their activities a lot, while 54% reported their activities as being limited a little. The condition disproportionately affects certain groups, particularly transgender individuals and those with disabilities. The higher prevalence among transgender and disabled adults underscores the health disparities that already exist in our society, highlighting the need for targeted public health interventions. According to a March 2024 analysis by researchers from UCLA and the University of Colorado Boulder, published by the Brookings Institution, the combination of behavioral changes in COVID-19 vaccination is estimated to have saved nearly 800,000 lives in the United States over the 4-year period from February 2020 to February 2024. This is a testament to the power of public health interventions. The model suggests that without COVID-19 vaccines, but with the same behavioral changes, the cumulative death toll would have been about 1,975,000 compared to the actual toll of about 1,180,000. This difference of approximately 795,000 deaths represents the estimated lives saved primarily due to COVID-19 vaccination. A powerful example of COVID-19 health misinformation is a retracted article titled "Face Masks in the COVID-19 Era, a Health Hypothesis." The article was published in an Elsevier journal called Medical Hypotheses in November of 2020 and retracted about 6 months later. The author selectively cited and misquoted published papers, distorted the data and science around the effectiveness of face masks, and inaccurately stated that he was affiliated with Stanford University and the VA Palo Alto Health System. When the story broke in April 2021, the article and false narrative surrounding it had been shared on Facebook nearly 28,000 times. Sadly, it continued to be shared and amplified across social media, where many hailed the author as a hero and the retraction of the so-called Stanford study as evidence of a malicious agenda. Even after being retracted, the false claims about face masks continued to spread, demonstrating how misinformation can outpace corrections and contribute to public mistrust. Here, you can see a table from the article in which the author listed what he described as the physiological effects, psychological effects, and health consequences of wearing face masks. This case illustrates how misinformation can penetrate peer-reviewed literature and spread rapidly on social media, even after retraction, highlighting the challenges in combating scientific misinformation during a pandemic. This example underscores why improving public science literacy is so important. People need to understand why retractions happen and why scientific consensus could change over time as we continue to examine and process information. I'd like to switch over now to the topic of generative AI misinformation. One of the required readings is titled ChatGPT and the Rise of Large Language Models, the New AI-Driven Infodemic Threat in Public Health. I'll provide a background for the article and share additional information about synthetic media, and deepfakes. We'll then look at recent Hurricane Helene disinformation, including deepfakes associated with Hurricane Helene. I'll then close by asking you 3 questions that I'd like for you to reflect upon. In ChatGPT and the rise of large language models, the authors illustrate that many researchers have not only used LLMs to write portions of their articles, but have also included LLMs as authors, including being listed as a first author without considering the possibility of involuntary plagiarism or intellectual property issues surrounding the output of the model. Consequently, Springer Nature journals have added guidelines indicating that LLMs cannot be listed as authors and that their use should be documented in the methods or acknowledgments sections. Elsevier has adopted similar rules and requires authors to specify the AI tools employed, giving details on their use. Additionally, in early 2023, the International Conference on Machine Learning took the step of banning LLM-generated content from submissions altogether. Though this relies heavily on the honesty of the participants due to the lack of effective detection tools, as well as the rapid pace of generative AI advancement. As of January 2024, the International Committee of Medical Journal Editors also requires disclosure of AI usage and emphasize that AI cannot be listed as an author since it cannot take responsibility for the integrity of the work. They also clarified that peer reviewers must obtain permission from the journal editor before using AI tools to facilitate their review. These recent updates underscore the growing concern over accountability, transparency, and ethical use of AI in scholarly research. Synthetic media refers to content created or modified by AI and other digital technologies. This includes a wide range of content types, such as written articles, news stories, social media posts, as well as multimedia like images, videos, music, voices, and even hyper-realistic human avatars. The defining characteristic of synthetic media is that it is generated or enhanced by technology rather than being directly captured or created by humans. Deepfakes are a specific type of synthetic media that use AI to create highly realistic yet fabricated media content. Deepfakes are frequently used in both entertainment and disinformation campaigns, given their potential to convincingly manipulate appearances and speech. With today's technology, it can be very difficult to tell whether any kind of media is real, manipulated, or generated. I'd like to take a moment to point out that Hurricane Helene has been the target of a coordinated disinformation campaign, including claims that the government is intentionally withholding aid from Republican disaster victims, which have been promoted by figures like former President Donald Trump and Congresswoman Marjorie Taylor Greene. Over the years, Greene has been known to promote conspiracy theories about wildfires, hurricanes, and other catastrophic events that are associated with climate change as somehow being caused by the government. Notice how extraordinary it is that tens of millions of people viewed her tweet within a week of her posting it. Other related examples include falsehoods that FEMA disaster relief funds were used on immigrants in the U.S. illegally. FEMA has been confiscating the property of Helene survivors, or FEMA will only provide $750 to disaster survivors to support their recovery. These misleading narratives have been amplified by social media, politicians, and hyperpolarized news media sources, aiming to create distrust in U.S. disaster response efforts. It's critical to combat these false claims by ensuring information comes from reliable and verified sources. This is one of the most viral deepfake images to have come out of the Hurricane Helene disinformation campaign. It's difficult to tell where the image initially originated from, but the earliest references to it that I could find came from Reddit, X, and the website patriots.win, which is a far-right online forum. Forums like patriots.win are generally community-driven, lack moderation, and often feature propaganda, conspiracy theories, and sourcing that's often questionable or fabricated. They are common places for deepfake images, videos, and audio to be uploaded, And from there, share it on social media platforms where they can be further spread and amplified. I've included links at the end of this presentation so that you can view any of the sources I've referenced. You have my permission to download the presentation and to share it if you'd like. I'm also sharing the presentation on YouTube for public viewing. I want to thank you all for allowing me the opportunity to share this recorded presentation with you all today. It's been a sincere honor and a privilege. I'll leave you today with 3 important discussion questions. First, how might public health professionals effectively combat health misinformation on social media platforms? Second, what are the unique challenges posed by AI-generated health misinformation, such as deepfakes, and how can public health professionals prepare to address them? And third, how can generative AI be used by public health professionals to effectively communicate complex scientific information to the public in a way that counters misinformation? Thank you.